So, so we're quickly trying to look at another rare route of drug administration. This one is known as what? Intra-articular. Alright. So articulation. Alright. Back in our pharmacology days, we said that articulation is like what? One bone and another bone is coming together. So if you are now saying intra-articular route of drug administration, you're basically saying you are administering a drug directly into a joint. Of course, as you are applying the drug into the joint, you want it to act just around the joint, just locally. So intra-articular route of drug administration involves what? Injecting medications directly into a joint space. All right. Of course, you want to treat a condition that is what? Wrong with that joint. Right. So treating localized conditions affecting deeper tissues such as inflammation, arthritis, joint pain. So this method ensures that what? Drugs act precisely at the affected joint, so it minimizes the drug from actually going into the whole system, because it's not the whole system that has the complications. The complication is actually coming locally from that joint. So key features of intra-articular administration is what? It's used to deliver anti-inflammatory, pain relieving or lubricating agents directly into a joint. It's commonly used to treat rheumatoid arthritis, osteoarthritis, joint injuries. Provides fast and target relief while reducing the need for systemic medications. Performed using a sterile needle and syringe, right, under imaging guidance, like all these ultrasound and X-rays for precision. All right. So examples of intra-articular drugs is what? You can corticosteroids, because you want to actually treat issues that have to do with inflammation, like triamcinolone, methylprednisolone. Then hyaluronic acid, basically, like the joint is stiff, so you want to like lubricate it. So things like Hyaluronic, then Synvisc. All right. Then platelet-rich plasma, regenerative therapy for joint healing. All right. Things like autologous platelet-rich plasma injections and all of that. So local anesthetics too. Let me say there's a joint, they want to do some procedures at the joint, so just give some anesthetic so that I can like numb the place for the procedure. There are things like what? Lidocaine, bupivacaine. Right. So antibiotics used in what? Cases of joint infections, like vancomycin for septic arthritis. So advantages is what? You are providing the drug relief just directly at the joint, so you minimize the drug from actually going to the whole system, so it reduces need for oral painkillers or anti-inflammatory drug. So if you have problems with the knee, just apply it directly to the knee.